My name is Allison Ansero, Senior Editor of the American Journal of Managed Care. Next week, ISPOR 2020 is taking place virtually, and today we are here with some of the panelists who will be talking about addressing gaps in value assessment. Garrison is with the University of Washington, and we're joined by attorney Leah Howard, Chief Operating Officer of the National Psoriasis Foundation. So thank you for joining us here today. To start out, Dr. Garrison, what are the gaps in value assessment, and haven't they narrowed in recent years?
Yeah, Allison, thanks very much for that question. I should say I'm had the pleasure of being invited to the IVI meeting back in February, and as a participant, wasn't an organizer, but really appreciate the efforts that Jen Bright and her colleagues are making in this area. They're really needed. And so I'm a bit of a kibitzer, but some of the, let me begin by highlighting a few of the things that we talked about were brought out as key issues. One is we need to really focus on patient-centered outcomes and be able to generate better data on patient-centered outcomes. Another big issue and a big kind of failing in our, and this is my view, in our learning healthcare system is the lack of data on real-world outcomes after a product or even a practice or a procedure or in the field. We have limited ability to collect data and limited incentives to collect it because it's expensive. So we don't really capture that, and that also makes it difficult for us to deal with the issue of patient heterogeneity and deal with that, which came up at our meeting. Value is the buzzword of the day, and so there was a lot of discussion around value-based insurance design, and all these things take a lot of time. That discussion's been around a long time, and we are closing the gap and making progress. And then I think we also came back to thinking about that real-world evidence in terms of longitudinal follow-up following trials, because in the area of medicines, it is somewhat unique that we have a regulated area of benefit risk assessment by the regulators, the FDA, and then we want to follow what happens over the rest of a product's life. And so that's a key area. And then we are the country with the highest percentage of GDP spending of any country in the world. And there's no doubt that there are many things we're doing that provide clinical benefit, but may not be worth the money. So there may be a lot of low value care, but we also want to be able to separate low value from high value, identify high value care, and really incentivize people to move towards high value care. So those were some of the gaps that were identified, at least my version of the gaps that were identified at the meeting in February. And I think there's progress in every one of those areas, and I can point to specific examples. We have companies that now routinely collect real world data and then provide that to manufacturers and payers, but it's very slow. It takes a long time. And so the gaps are being closed, but we really need organizations like IVI to really push that as a convening the groups, various stakeholders who have a stake in that. We all have a stake in that because we're all patients, but we want to bring that together and see if we can move that forward as a group of stakeholders in a consensus kind of way.
And Leah, how is real world data helping to improve value assessment, especially from the patient point of view?
Real world data is fascinating. And I think when you look at patient communities, I work with the National Psoriasis Foundation. We represent individuals living with psoriasis and psoriatic arthritis. And what's amazing is we're a community of about just over 8 million people. And when you talk to an individual with a chronic disease like psoriasis, what you find is that their experience is often different, very different in some cases from someone else living with the disease. And so value assessment is so important because what we need to be doing is thinking about, at the end of the day, who's really benefiting from the care that we're talking about, from the treatments that we're discussing, and that's the end patient. But without looking at the patient and talking to the patient directly about what's important and meaningful to them, it's really hard to pursue high value care and really to be having discussions around value. And so what real world evidence and real world data does is it gives us the ability to really draw from what we know about patient communities, what we know about treatment options in certain disease spaces, and bring that data to the conversation. So value assessment is certainly a complex issue, and one that We want to be drawing in as much data as we can. And I think the more that we're able to pull that data in, ultimately, the more we're able to refine and improve value assessment to then at the end of the day, bring better outcomes to patients.
Do we need different infrastructure to capture patient-reported outcomes, real-world data, that sort of thing, Dr. Garrison?
Yes, and again, I'm kind of speaking from the academic perspective. I really appreciated what Leah just said about the challenges ahead and how important it is to kind of measure these things from a patient perspective, the patient-centered kind of approach. We have a limited infrastructure. We've certainly been trying to make improvements in medical records data collection, and certainly I think that the Affordable Care Act supported some innovations in that area. But at the same time, at least from my personal perspective as an economist, there is a fundamental problem of incentives that everybody has kind of an incentive to let other people do the hard work to collect the data. So how do you address that? Well, one way to address that was the Patient-Centered Outcomes Research Institute, which is a federal subsidy to collect information. I would just say, in my view, was a great idea, but it even with some dedicated funding, it's not enough because it's very expensive to collect these data. We also see things in the private sector, agreements where outcomes-based agreements, or what are called value-based arrangements or agreements between manufacturers and payers to try to collect data. There's some incentive to do that, but again, there are some free rider issues. The infrastructures, there are companies out there that are trying to improve the infrastructure. We've spent a lot of time on trying to do natural language processing of medical records. My impression is, and I'm not an expert on that has been helpful, but hasn't solved the problem, and that they've kind of moved towards some combination of human-assisted artificial intelligence and so on to try to extract data from the records that we have. And so there's room to improve the infrastructure. It's needed. There's also, it's important to give people the incentive to collect and share the information.
Earlier, we briefly referred to the stakeholder meeting that IVI held at the end of February of this year that discussed this topic. And since then, unfortunately, we've all seen the chaotic upheaval due to COVID-19. Given the magnitude of the crisis, financial and otherwise, do you think that the impact, for better or worse, will discussions around value assessment change over the coming years? Leah, do you think?
I actually believe that the discussions around value assessment are going to become more important in the coming years. I think as we look at the challenges placed by the current healthcare pandemic on our system, I think these questions around value and whether, for example, one treatment delivers more value to a patient than another, I think is going to become all the more important. We know that patient communities and individuals and families are certainly feeling the financial strain of this crisis. And so as they think about where their limited dollars are going, the dollars that they're intending to put forward for healthcare, for example, they want to make sure that they're getting the highest value for those dollars. And so I think value assessment is going to be even more meaningful than it has been. Certainly we want it to be scientifically credible and we want it to be meaningful. And those things are going to be important. And that's why looking at the gaps, looking at the data inputs that are needed is so important as we move value assessment forward in the next few years.
Is there anything else that either one of you want to add about this topic or about the upcoming ISPOR meeting next week?
Well, no, I would just agree with what Leah said, that I think, someone had once, I think Rahm Emanuel once said, a crisis is a terrible thing to waste, or something to that effect. We have a crisis and we're being confronted with value questions. How, we really all have a powerful incentive to see innovation in medicines for the COVID or vaccines. So how are we going to reward that? And it's going to, it's additional spending. It's not spending that we had planned, right? And that's going to put pressure on other aspects of the trade-offs that we have around value. So we have to somehow decide, well, what's valuable in those and how do we reward that? And I think we'll want this broader concept of value because, for one thing is we're talking about an infectious disease. So each person's behavior affects other people. It's not just an individual taking care of themselves. So you have to think of value from that perspective. And I think that's going to focus that. And, you know, there's also this other dimension of impacts on other aspects of life, your employment, your family, you know, that are a broader concept of value than sometimes we've been used to in the past. And we need to think about that as we think about this next era that we're entering.
Well, thank you so much for joining us here today. We really appreciate it.
Thank you for having me.
Allison, and thanks to IVI for moving this forward. So,
Stay safe.
bye-bye.
Bye.
You as well.